First, we'll start about what we know about COVID-19. It's a novel coronavirus that emerged in Hubei province, People's Republic of China, actually in December of 2019. There is some emerging evidence it was actually detected well before that, earlier in 2019, but that information appears to have been suppressed by the Chinese government. It's in the same family of viruses as the common cold. The common cold is a coronavirus. And on the opposite end of the spectrum, it's also in the same family as severe acute respiratory syndrome, which is that virus that circulated in 2005 and had a mortality rate of upwards of 10%. So far, it looks like this falls in between there. It appears to spread as easily as the common cold, and we're seeing incidences now of person-to-person and now community transmission. And when I say community transmission, that means when somebody comes down with this illness, we can't immediately link them to the person they contracted the virus from. It's coming from an unknown source in the community. The current fatality rate's 3%. I put an asterisk on that, and I'll talk about that. It's actually 3.4% as of this morning. A couple things to focus on. Outcomes for those who are young in age, moderate in age, and in good health, they're showing symptoms that are consistent with a bad cold. People of advanced age and people with significant existing health issues, specifically existing respiratory issues, have poorer outcomes. One thing of significant note, when you have an emerging disease where we have no natural immunity, you expect the very young and the very old to be the ones with the worst outcome. The very old are presenting that way. The very young so far have not. The very young don't seem to be as heavily impacted, and when I say poor outcome, I mean death. Don't seem to be as heavily impacted as the very old do, at least in cases we've seen thus far. The asterisk, there is a growing body of evidence that suggests that this virus is likely in wider spread circulation than what has been tested for and detected. And if that is the case, it likely means that that fatality rate is significantly lower than what we know the fatality rate is. Because right now we're using data based upon confirmed cases. So people who have tested positive or people who are epi-linked to a confirmed positive case. Symptoms. It's the same as a common cold for the majority of folks. That can degenerate into severe pneumonia requiring hospitalization and supportive care. It is a viral illness. There is no cure, and treatment is basically supportive therapy. The majority of people who contract this illness will recover with no lasting or significant effects. A small minority of people will have to be hospitalized for supportive therapy, and an even smaller minority of people will likely expire because of the illness. History. Initially detected in Wuhan City, which is a large city in Hubei province of the People's Republic of China. It's now confirmed in more than 75 locations internationally, including the United States. These are the numbers as of 9:15 this morning. I know they have changed slightly since then. 94,250 confirmed cases, 128 confirmed cases in the United States. 51,026 of those cases have recovered, so a little over half of the confirmed cases so far have recovered from that illness and are no longer sick. 8 of the confirmed 128 in the U.S. have recovered. Worldwide, there have been 3,214 confirmed deaths and 9 confirmed deaths in the U.S. And some of those deaths were for people who expired from the illness and they were tested post-mortem and determined they actually went back, and some of these folks died last week and the week before. They presented, they weren't known as being epi-linked, so they weren't tested initially. And they were diagnosed with a viral pneumonia and expired from that, which was an accurate diagnosis. It was a specific viral pneumonia in this case. What we don't know, and this is the big one, we don't know the true number of cases because we can't test everyone. There is the potential that a large number of folks who have this virus have an illness that is mild to moderate and aren't presenting for medical care. Well, if they're not presenting for medical care, they're not going to be tested. The next one's kind of concerning, but it's a reality at this point. A growing number of cases, specifically in the U.S. along the east and west coasts, are cases of community origin, where folks are becoming ill and diagnosed with this illness, but we don't know where they got it. That's indicative of an illness that's now in circulation within the general public. Coronaviruses mutate frequently, and this virus has already mutated in that there's at least 2 genetically disparate mutations of this specific virus that they have confirmed. One is becoming more prevalent than the other. The virus that emerged first, evidence is suggesting was actually more severe and caused a much higher fatality rate, but its fatality rate was likely so high that it was self-controlling, and a less serious form or mutation of this virus has now emerged, and that seems to be what is spreading throughout the world. The last question that remains unanswered is, what will seasonal factors do in terms of transmission of the illness? As you know, common colds are most common in the winter and fall months, and as spring emerges, our physiological changes as well as societal behaviors impact how that disease spreads, illness spreads, and reduces to the point where in the summer months common colds are significantly fewer. We do have a little bit of historical context here. The SARS outbreak of 2005 slowed in the summer months but continued into July of that year. But it had significantly worse health outcomes and was ultimately a self-limiting virus in terms of severity versus transmission. We don't know where this one's going to be yet. Containment measures that are currently enacted. The first are travel restrictions. Foreign nationals who have been within the People's Republic of China in the last 14 days are not allowed in the United States currently. U.S. citizens and resident aliens who have traveled from anywhere there is a current outbreak are allowed to enter the U.S. because the United States cannot restrict entry of a United States citizen or resident alien. But they are funneled through 11 airports within the U.S. where they are screened. If they are symptomatic, they are immediately quarantined under federal quarantine. If they aren't symptomatic, they are sent home and placed under voluntary isolation for the following 14 days. And that process involves them making contact with the local health department, and we check on them once a day for 14 days, monitoring them for signs or symptoms. That means they take their own temperature every day, we call them, they call us, whichever, twice a day. And we just have a conversation with them. How are you feeling today? Do you have a fever? Do you have a cough? Do you have symptoms of cold? Is your nose running? If they begin to develop signs or symptoms, then we arrange for appropriate medical care for that person. There are none of those people currently in Clinton County. There are counties that border Clinton County that have multiple persons within that category currently. We likely will at some point. The second U.S. countermeasure that they currently have in place are travel advisories for U.S. citizens. Currently, folks in the U.S. are advised to avoid all non-essential travel to the People's Republic of China, Korea, Iran, and Italy. Also, U.S. citizens are strongly discouraged from traveling by cruise ship anywhere in Asia. Expect those to change. And expectations. First, likely this is an illness that is in community circulation, which means it will spread across the United States. It's coming here. It's going to become endemic within our society. Expect that. As that happens, a more clear picture of how this really impacts our community will emerge. We will get a better handle on mortality versus morbidity, the number of people who contract the illness versus the number of people who succumb to the illness. But the reality is, at this point, it's highly unlikely that this illness will be contained and prevented from spreading throughout the United States. So that's out of the way. It's time to address what the public can do to reduce the risk and what to do if they do become ill. This spreads like the common cold, so prevention strategies are the same for every seasonal illness out there. Avoid close contact with people who are sick. If you're sick, stay home. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands frequently, at least 5 times a day. And use soap and water when you do that for at least 20 seconds, and follow that on with an alcohol-based hand sanitizer that's at least 60% alcohol. Sanitizer is not as good as soap, but it's an excellent adjunct to soap after you wash your hands. And if soap and water aren't available for field crews, field staff, something like that, it is an appropriate alternative. Ineffective protective measures. And here's one where the panic of society is kind of causing an issue for healthcare providers. Surgical masks don't prevent you from contracting this illness. They're not effective at it. They are designed to prevent an outflow of droplets from the wearer, not an inflow of droplets to the wearer. They don't seal effectively. There's large gaps around the perimeter. They are effective as a protective device for somebody who is or may have contracted this illness and you're treating them. That's an appropriate countermeasure to place on that person. And then the other popular item out there are N95 masks. They are effective at preventing transmission to you if you've been fit tested and they fit appropriately, but they can't be worn for long periods of time because they're difficult to breathe through. Some folks are medically contraindicated from wearing them because if you have an existing respiratory illness, COPD, something like that, it's too hard to breathe through an N95 and you just can't do it. One of my staff actually, who was traveling abroad recently, carried N95s with her, and she attested to the fact that you can't wear one for a long period of time simply because it's uncomfortable. You end up with lesions where the straps rub, lesions on your nose just from the mask rubbing, and it's difficult to maintain a proper seal around the periphery of the mask. Community preparedness. And when I say community, this is society as a whole within our towns and county. Actively encouraging the folks that are ill to stay at home. And I understand that this has significant impacts upon the services we provide. It has significant impacts upon our businesses, and it has significant impacts on our families. But if you're sick and you can do it, stay home. And that applies not just to COVID-19, that applies to the flu. And in reality, while you likely will emerge from the illness in good shape, there are those within our society that won't, and this protects them. Model respiratory etiquette and hand hygiene. Cover your cough, wash your hands, encourage those around you to do the same thing. Social distancing. Maintain appropriate space between you and the people around you in the community. Avoid large crowds. That means, well, I guess we don't have football games going on right now, but we do have state basketball ongoing right now. And encouraging people to avoid crowds, especially if they're ill. Routine environmental cleaning with appropriate products following the manufacturer's instructions. That goes without saying. And then assess the impacts that closures could have on you, whether you are representative of a church, school, business, healthcare. Start to plan for what to do if, and this is directed at the lay public. That's what this slide deck is directed at. We'll move to our emergency responder slide deck here in a few minutes. As a family, be prepared to be self-supportive and sustain yourselves for 14 days without leaving your house. And that means having an appropriate amount of non-perishable food at home that you can stay home for 14 days. I understand by that 14th day you're probably on rice and beans and it's not going to taste very good, so keep lots of salt and pepper there too. If you're sick, self-isolate and stay home. Avoid large crowds and maintain an appropriate distance. And right now that appropriate distance for COVID-19 is 6 feet. That's a long way in our society. Between you and others who are not part of your household. Good respiratory etiquette. Cover your cough, wash your hands, and not just at home, but where you work, ensure that surfaces are cleaned up with an appropriate product often. And then here comes the fun part, business continuity. Develop a plan to keep your businesses functional even if you have a staff attrition that's exceeding 30%. Cross-train your staff to fill critical responsibilities and functions that you have to have in order for your business to carry on providing the services it provides. And enact the same control measures that we use at home. So when it shows up, what are we going to do? Because it's going to come. I put quarantine on there. These are not, at this point, we have no plans for issuing government-mandated quarantines. These are voluntary quarantines. If somebody is ill within the household, be prepared for that whole family to stay at home for 14 days or until they have recovered. But isolate that person within the home. Put them in the basement, put them in their bedroom, and one caregiver cares for that person to try and prevent spread within the family. And at the end of the day, expect significant impacts to our businesses, our emergency services, our governmental services, all of that, all of those things that we depend on as a society. And this is I've got informational links, and I can send those to you. These are all public informational links, and they're all excellent, provide great information. That bottom one from Johns Hopkins, it's a real-time map, and I actually have that pulled up. If I go over here, and if I can figure out where my mouse cursor is. It's a real-time map of the impact associated with this illness. I have the U.S. zoomed in on the map portion, but it shows the whole world. And if you continue to watch, and this is up current as of 10:53 is the last time I refreshed the map. Lower right, confirmed illnesses are in orange, recovered from current illness are in green. Mainland China, is confirmed. Recovered from illness is in orange. Locations outside of mainland China are in yellow. Well, I didn't know what I wanted. There we go. Questions? And there's nobody from the lay public here, so, okay.
I did have a question.
Shoot.
The mortality rate, you're saying 3% or a little bit above that?
Yeah, 3.4 currently.
Keeping that relative, what would that be compared to, say, SARS or even influenza A?
So SARS was just over 10%. Of course, the cases of SARS were significantly lower than what we're seeing with this. A typical flu year is 0.1%.
Say an influenza A.
So a bad flu year is between 0.01 and 0.1%. So significantly worse than flu, about 10 times is what they're saying, though that's conservative. But significantly less impactful as in terms of mortality versus SARS. And the thing to remember there is
Blair, can you put that slide with the websites back up on?
yeah, and I can email that to all of you, or I can just email that with all those slides on there. And CDC has specific guidance for educators, in terms of planning, for healthcare providers, both pre-hospital and hospital, for law enforcement, for fire and EMS, as well as PSAPs with guidance on pre-screening and appropriate PPE actions for pre-hospital providers, including law and fire if you serve as first responders in your community. So we'll just email the whole slide deck out. It has those links. What other questions do you have? Yes, sir.
Right now, you're kind of seeing a reaction where you see a lot of folks in the full moon suits and the full.
You're seeing, yes.
As this starts to spread, that's kind of going to go away.
It is.
It kind of becomes pointless.
That fear. Well, so there's with any emerging illness where you have a significant mortality rate, there's always that initial, we don't know how bad it is, and we're going to react very, very strongly, and that's typical. As this becomes more endemic and widespread, you're going to see some of that public fear dissipate and some of that reactionary and sometimes inappropriate reactionary response go away. And, you know, there's appropriate PPE that for if you're caring for a patient who has this illness. But, you know, a level A hazmat suit's probably not an appropriate level of PPE for this. Respiratory protection for caregivers in close contact, yeah. And there is guidance out there for hospitals in terms of negative pressure rooms and isolation. And then part of the discussion we're going to have today is about resource depletion and our lack of those resources, because we don't have a lot of isolation rooms available in our hospital. None of them. And it's that time of year when a lot of folks thrown in isolation. I mean, your isolation facility is probably in constant use right now because, I mean, it's flu season. And you don't want the rest of the hospital, nosocomially becoming ill from influenza if you can stop it. So one of the items we're going to discuss, and part of this is just having a roundtable and talking about our options and what we want to do to mitigate this as best we can, and beyond mitigation, how we're going to react to it when it does show up. Because we know we're resource poor in so many factors. We're a rural community, and that's just a fact of life. It doesn't matter if you're a rural or an urban community, you're resource poor at this point. We don't have enough resources to respond appropriately if this becomes a significant outbreak with a lot of folks requiring supportive care in a hospital. This is a time of year when hospital census is 100+%, and they're struggling to find a bed to admit somebody, and they're hanging out in the ER for hours on end until a bed opens up. It's just the way it is. Any other questions before we move on to specific? And what we'll do is this next one, we'll move on to specific vocations and discuss some things in a little more detail. That was the extent of my public briefing. That said, you're more than welcome to stay. There's just certain items that we ask that you not publish.
Oh, yeah, sure.
I mean, you're more than welcome to join us for the conversation. It's just and specifically, there's